How to prevent frequent asthma attacks? Normally, the disease asthma is variable disease, which variable bronchospasm. It keeps coming back, going, and people will not understand the importance of taking medications regularly, especially in moderate to severe asthma. So, any asthmatics, whether it's a mild, moderate, or severe, they are more prone to exacerbation, irrespective of whatever you do. So, exacerbations will make their lung function better, and school absentism, hospitalizations, all those things increases the morbidity. So prevention of exacerbations is taking the inhalers correctly. So whenever there is a flu or this thing, they can take their flu shots, pneumonia shots. They are prevent from infections are one of the triggers. Other things, when they are cleaning their wardrobes and other things, wearing the mask, and going somewhere else if they are prone to infections like flu and other things, wearing the mask. These are important things to prevent the exacerbation. Sometimes firecrackers and all those things in environmental air pollutions while driving, all those things triggers can exacerbate asthma. So sometimes emotional triggers can also get exacerbated. So the any trigger which will precipitate the development of worsening symptoms can cause exacerbations. So if you take care of all those things which will create exacerbations, most of the time 50 to 60% can be prevented. Sometimes, like house dust mite allergy, we give immunotherapy to do desensitizers. So allergen desensitizations will be done so that they don't get exacerbations, and symptom relief will be there. Hi all, I am Dr. Hirennappa B Udnur, Pulmonologist practicing at Inspire Specialty Clinic Sahakar Nagar, Bangalore. Food allergy is one of the common things. Apart from the aero allergens, what we have explained previously, a lot of food allergens. Usually, when we see routinely, the common food allergens which we see are usually they are allergic to peanuts or sometimes nuts, and usually citrus fruits can cause allergy, and bananas and brinjal, and the varying number, umpteen number of foods which are being there. Some people will have milk allergies. So specific food allergies are altogether a total topic which has been available, and they can cause all kinds of symptoms, including abdominal and respiratory or nasal symptoms or skin symptoms. So food allergy panels are also available in a blood based test, or we can do a food allergy test based on their symptom criteria and look for skin prick test, which are largely specific, and component therapies and all those things have been gaining momentum. And when we really work up, these allergens are really less in terms of food allergy. They are specific the number compared to aero allergens. The quantum of these food allergen specific diseases are less, but definitely we can identify the specific food items who they are allergic to. What are the breathing exercises for asthma? So normally asthma is a disease from thing where we get bronchospasms and cough, wheeze, chest tightness. These are the symptoms normally which requires medications like inhaled steroid with long-acting bronchodilator in adults, and they can keep the disease under control. The inflammation is ongoing, so that's why we need a treatment which is ongoing, and bronchospasm is intermittent, which needs reliever medications. So we need to look after our lung health well. So when we talk about lung health, so if you do yoga, pranayama, incentive spirometry, breathing exercises, all this definitely helps for asthma. So there's no specific written test that these are the tests which are to be done for asthma. Definitely anything which we do to keep our lung health as a respiratory system, and exposure to pollutions, all those things, and which can keep your, and prevention of smoking, vaccination and other things, and regular exercises and yoga and pranayama, they have been proven beneficial, so that if their lung health is good, they may not get exacerbations and the disease is well controlled.